Matataan na inututi tao yung hangatay na tamako tao ng kawyisa ko tao nga sumato sa law sa mga tigo pipalayo liri dito sa kaya tao katakalaw tilo.
Our policy is that we'll discuss positive results if they're confirmed or presumptive, and we'll discuss number of contacts who are under isolation when it's over 5. People under investigation or people who are being isolated for other reasons, or what we could be called or what are called indeterminate results. We don't discuss those because they're low, they present no risk to the public, and so that's why we have not talked about any of those circumstances, and there have been cases of indeterminate results in Nunavut. Sorry, Uli, I'm going on too long.
Yeah, too long.
Okay. I'll let Uli translate and then I'll continue.
Ato aga hakatta tayo mga kasi hakatta jangin at tayo mapasagi jaw unik kupaluni nalo na tayo sa mangitunik tanlimaw lang pataw nga tani tako kaw isak tayo yun inutuga hakti tayo asingin ni pidyo te harlutik tako nalo na tayo lang ngin ni tayo mahulo ka na ko tayo ngin matakik ko tuyo nang nasang magayang ninginik tayo mga kasi rin katang itabo tamat ko pasagi jaw tuyo nakto.
So there have been a number of times where we've had people under investigation, where we've been following them closely because of isolation requirements, because of indeterminate testing or symptoms, or we think they may have had a high-risk exposure in the south. But until there's a clear risk that could, let me correct that, clear evidence that there could be a risk to Nunavut, we respect the individual's privacy and don't discuss it.
Tana tayo sa akin tayo mga sakit to hakatak sa mayo kaw isak pala hakatak sa mayo bu inutuga hakti tayo yun malikat tangata suli kaw isak pala tayo yaw sinak tilugid ubalo kani maguti hakto yakata ubalo ni kallo na ni kay mga sir maktawi ubajak tuminiw yakata sakit sukak sa mamatay mga kaw isak pala hakatak ni kingun ni agud nalo na tayo law tilugid kisani nalo na ilah o kaw sigur naksakat tangata.
This question is coming from the Facebook feed. There are rumors about isolation hubs being reduced to 7 days. Is there any truth in that?
Tana pek kuti sa mayo Facebook kuti go tayo mga go to sak sa mayo hangata ko nailigar tayo hangata ullo it 7 no ullo no taman na suli ba?
No, there's no truth to that. There's speculation in infectious disease experts about whether or not you could use testing to shorten isolation, but there's no plans on doing that, and there's no, I don't even know if anybody's doing the research needed to back up that speculation.
Aga, taman na sulingit dok, taman na isa magayaw si matuwid naktugalo at magkuno nga siya mapalyaso ni kaniman nang ni kaway mayitarnot kasi ani kaway sakta katalut tayo ma kilame unak sakko inuto katara harayang ningin ni kasi ani man na tayo mapang na si mayo kang ito kamalo kaway sakko tininalo na tayo si mayo kang matay manay na tayo ng mga ata inutuga hakti tayo katami.
If we find an alternate way of isolating people, either adjusting the time frame, but it's backed up with good evidence, then we'll look at it at that time.
Asingin ni sa go bigo nakto ni kaway sa kung nakaluwak tigo kano tigil ng mga takisani nalo na sa malaki to ni kaway lang nitin ni taman na si Jack taw jangit sakto.
Thank you. Minister Hickes, please. We've heard a number of stories about people getting kicked out of the isolation hubs for drinking and then becoming homeless. Can you say how many people have been kicked out because of drinking?
To sa mga matata ko ani titaw yo kakatak sa mga emir si mayo ni ang ayak to ni ang kakaram ni sa makito ti katsi mga tao karam nakit.
I don't have an exact number for you today, Jackie. I know there has been issues with people breaking their isolation and having to restart. And there has been a few people that the hotel has refused to take back due to behavioral issues. That's where the challenge comes in, and how do we get those people home? There are, we have mental health people working in the facilities, working with people on a daily basis. It's one of the struggles that we're having.
Jackie, how you manage to catch your mangata? Kisane to Sakatas Magaluak to Sekumiti, Unita, mine to get ham ng minikamalu, Pigal Kikanara Hasung, Matatu, maybe meet it down in it. Ilan Tamakuning and I let saying it to Sakataluak the good. Hanolotako ang ipakita na mga isumalo tigalo sutigo ang malo isumalirin unlutamate kan ito yung nakatsangin nakto taman natagat sa rutigiyabo.
Just to follow up a little bit more, when I say it's a struggle, it is a struggle for people going through the isolation. There are challenges. It's you're locked away for 2 weeks. And there seems to be this misconception that this is some type of punitive measure that the government of Nunavut is taking on people. We're expending a lot of resources, a lot of money to help keep Nunavut safe. And we need everyone's cooperation. I understand there are people with addictions issues and there are people with mental health issues. We're doing our best to provide the supports to those people to help them through the isolation process. But has to be some responsibility for the people that are going through as well too. I'll stop there for a moment.
Okay. Kiuga kannerlugutaan na taman na ilat so tirin iqartara tamakko inutu qattarialit suurluk isumain nakigunni qattanga tapina saaqusin nimaqqunnik tamakko alo ima inertertaugia qutiussuriyaa qattanga tailanginnut taakkoalu kiinoyaqasarna atuqattaqatta taimaa pidjutti qaluarnerpaangugatta Nunavummiut attanartumiiliqunagit kikkulimaa taimaa pijatsahangata ikajoqatigiigaaharnermi naalatsiaqaaharnermi qauyimagaluarsuta tamakkoa ajuliqutiqarsimayut kammalu issumaarmigu akaqqijaaruteqangittut tamanna ikajoqasuaqattartavu qanulimaa inutuugiahartitautillugi taakkoattau imminik inuit naalatsiaqaaharmiyuugalua.
When I talk about responsibility, a lot of the complaints that we receive or that make it up to me are from other people in isolation on the behavior of other people in isolation. There's security that we have on hand. Like I said, there's mental health workers that can help assist people with their addictions. We've put out smoking cessation products availability to people to help with the stresses of not being able to smoke maybe as regularly as they normally would. I don't know what the answer is. We are doing our best to make sure that Nunavut in territory are safe. And this 2-week isolation process is that step that we're needing to take to help keep our entire population safe. And the risky behavior by the few that are jeopardizing not only the safety of the people that are going through the isolation, but also the safety of Nunavut. And I think there needs to be a concerted effort by everyone to do their best, to do their part. There's a social responsibility that we all have in this, and I am asking everyone to help play their positive part in that role.
Ukausa hartillunga taakko attuni nammineq pileriat sahartiugaluarmimmata taannaunnerluutaujuni tusaqattainnaq miyuugalua assinginnik tamakkuninga tujurmivimmi qataujunnik unnerluutiqartunik naalatsiangittunillu taakko awaatsisiqainnarsutik ammalu issumalerinermu ikajortiqainnartuugaluat tamakkualu siggaliamu noqqaqasuarnermuut noqqaqasuarutini atuinnartaqartu taakko siggaliartureartuinna qattarunna ilaqattangata kisaani apeqqutiuvu taanna Nunavut attanartumiittaivittaugiaharninga tamaani Nunavummiut taakko maqqupinasaarusi inutuukkainnartitsiqattarni Nunavummi attanartumi ulureanartumiittailititsigutiummat tamakko ulureanartumi imaa pinerluutiqartu naalatsianginermut tamatuminga hanuinni gunnarninginni Nunavummiuni kammalu tujurmivimmiiqatinginni ulureanartumiititsirgutiaummat taakko iluunati atangertutik imaa atsuruutiqatsiaqaaliit tamatumunga ikajuqullugit saamartailititsinermu.
The people who asked not to come back because of behavioral challenges, what responsibility does the GN have to those people?
Taakkuno hoterun nailisima jounu kanno Nunavut government pileriat sa hakti o taakkuno nga ajuliksima jounu taunani.
I don't want to put people in different classifications, but when people are on medical travel, as an example, they're under our care. If it was you or I traveling down on our own behalf, it's up to us as an individual to be able to accommodate the isolation, to be able to return home safely to the community. So that's the dilemma, is where does that responsibility start and stop? We've put in some very stringent measures to protect the safety of all Nunavut, but people that are traveling have to have that level of responsibility, of self-responsibility, that they have a part to play in that too.
Kikutui näitä makkoa jiingituni pitsuta harsuti aulla hattarea hangata. Taakko oli pileriat saluat noira jengi kova makkoa annerbilaks tutik aullakti tauhattartut. Taakko asuli ippigimmakin Nunavut kova makkungita. Kisään ippiukangalunni aullarnerunno pitjutit sahaluangit lunuk teemaa utirea hamnermo pileriat sarjauga jälerme jussi kisiani. Tämän nakaungiliurutiu naukku hangakku pileriat sarjunni rajartavu tamakkoa naalat särsimangittuugalua kisiani tämän aullahattarnermo tämän namminertau utjirit sarluti malit saaraa haaluarmemmata.
This is a question coming from the Facebook feed. Trevor Norris wants to know why GN employees are being barred from working from isolation when they spent 11 weeks working from home.
How many weeks?
Pardon?
Say
Oh,
that
11.
again. Oh, 11. Tagna tau Facebook ka pekkutisima jo Trevor Norris aperiunu na government kungita ko sumang kami ni kanayak titaw gunailit takat pinasarusam na 11 ni tay may gunang nakaktaw laukalawak tilawi.
And that's a difficult question in some respects, Jackie, where each GN employee has a different role. It depends upon what your operational requirements of that department or division has, what your role is in it. Some people are able to work from home or work from outside of the office. Other jobs can't. If you're, data entry, finance, when you're doing your data entry, you can't do it from home or you can't do it from the hotel. It has to be on a GN network. So there are some jobs that can work from home from a distance and others that just can't.
Adjiging itu matatako Nunavut government kungin ne kanayak ti adjiging itu ne kanaya hangata sulu aulat sinarmo pinmayo patay kanayangit ilang yang kami ne kanaya kung naktugalo kasi ilang yang kanayang kaksmagunak nitsa marin matasulu karisaw yang muna kite kinaw yaliri kunni Nunavut government kung itahakasaw yung latangin ni kasi natong lutiw gahang kata kasi ilang ang kaksmagunak tugalo asuli.
Megan Dooling, Nunatsiaq News. Keep it up with the job questions. I'm wondering how many GN employees do you know have stopped doing their regular jobs and started working on COVID-related things?
Megan Dooling Nunatsiaq kunnik tako ikanaya rin ang mapidyo tigillugo katsiyo ba Nunavut government kung inni ikanaya lata mini ikanaya haruner sa Nunavut Jan 19 kami kamalakto.
Thanks for the question, Megan. It's actually a good one in the respect. I don't have an exact number for you. Obviously, there's different people that are stepping up to the plate in many different facets. I think that out of your question, the biggest thing that I got is that there's not many people that have stopped doing what their normal role is to work on COVID-19 issues. In a lot of cases, it's on top of their day-to-day duties. And that's where the concern that I've had is, staff burnout. When you've still got your day job and you're dealing with COVID-19 related, isolation hubs or other measures, it creates a real challenge capacity-wise.
Yan na may natakkutit siya bak katsiulat ta mga takaw yung mga Iqaluit nga kasi ikanaya rin ita minita ma kamat siya rin naksimamata amisulo ang ito tayo makko Nunavut na 19 na mo piliriat sa haktiyo yung sulo ikanaya nga takakan nga gutamak tumi nga kamanga sikatang ata Amalo isumalo naksakatto tako kanayakti takalo akajarningin ni kasingin ni kamayahakti lugitay may mat kanayakti katsara hamna musuli isumalo tikaktu.
But I would say the two most directly impacted departments would be Community Government Services and the Department of Health, dealing with the isolation hubs and the airline issues with economic development and transportation. So there are quite a number of people that have taken on quite an additional workload.
Tako gavamakko pilirivingin nattok tau semanakpano nalinni gavamakko nilo pijit siraktikut amalo anna hamnangit tulirikut. Kamagaya hakto tako ninga inutukay na biugalin ni halunani amalo pivalle ayulirikku ngi kajulirikkullo tamakko no ngi kajulirin mo ngayon ni pilirakan nakakatalaktot tamakko akakan ninga gomisu kanayangi ta kamagaya hakattakto.
So what are you doing, what is the GN doing to make sure that people aren't burning out, and also if they are maybe letting some normal things that they would be doing slip to make sure that the things are progressing as you planned before COVID happened?
Nunavut gavamakko kanuili katamakko takalo ale ko nagit kanayak tingit takwet kanayang atakakan ninga gut pang nataw sumayunik kano pinirangoban.
Well, and it's very case specific, obviously, Megan. I know of staff that are almost being told to take a little bit of time off as a break. Dr. Patterson can speak to how many hours a day that people in health are putting in over and above their normal duties. As a government, we've given that the extra summer bonus days to encourage people to take some time here. I think it's very important to recognize the work-life balance, and it's harder for some of us than others. But I think everyone needs to take a little step back and talk to their supervisor, talk to your manager to address any concerns.
Tako ato ni nalunay yakta katalo tikisiya New York tako aloy kanayak ti ilangit takayok si kay nakuyaw katakto ilanik ko kikakay naklutik tako alo luta Patterson kanaya katingi kakasalo ni kanaya katang atay kanaya nga takakan ni ngagawa na hamang ituliriyik kunni tako alo Nunavut gavamakko isakir si sumayo aw yak ko kikakan ni rutit sanik amkhaw yung magahakat tatamakko nalimugit siya hangay no usirmini kanaya minilo tay may ang iyo kami no ukalimakata ko nakto isumalo tingini.
We've been hearing from some nurses that they've been told that they can't take time off that they've requested. So how does that fly with what you just said, where you're encouraging extra time off?
Tusak si mamataan na siyo tigo tako kikakuyang yung mataman na yung ilo ano nga ako sila kataptan no kano taman no ako sila na kayo.
And that's a challenge when you talk about operational requirements. It's not like some divisions you can cut your staff down over summer months and the workload isn't as high. When you have minimum requirements related to health, we have an obligation to provide that service. And it does put a challenge into maybe not being the exact time that people want to take off. We do have to work with seniority as well too. So we do want to make sure that people do get a break. It may not be the exact time frame that people request due to being able to get, whether it be casual nurses in or other contracted services. So I can assure you that all people, all managers and all leadership are doing our best to be able to give people the time that they ask for.
Taman na lahat so na ko tigil mawala taw gali pidyo tigil lugit ilangi kavamakko ni kanayak beoyot solo aw yakko piliriyat sa kalwa ko ni katangata kasi ni tawlian na tulirin mo tamakko malik sa ila pidyo sa kaw takakahangata inulisay na kumukuyok tako hangak ko kikakbigay gumayangin ni angyak taw jayot sa mitu galawat tako ang ayok kaw ti sibuliw ti kikak gunak ti tao sa mata kasi anit tao tamakko kikakay nakataw na hulog tayo anasok tayo kay nang natin kanayak ti tao kaso kataktugot tako alo ang ayok kaya yuli mata nanunak bios na mayud ima kikakmayo na kikaktit siga sa akong nakatakulog tayo awla tao niya to akata.
I understand that the Department of Education is meeting today with DEAs about reopening school plans in September. Why wasn't the Department of Education working with the DEAs the whole time to make these plans? Why did they have to hear about schools reopening in the media?
Tukisiyo mayakut ako anahan ilinnak tuliriyikut ullumigo kati makati khamneanga ilinnak tuliriyikut kati mayingin matukan nila ningin ilinnak be September mi summalita ko ilinnak tuliriyikut kati mayingin nunalin nito sa kattara hatta kamatukan nila nang mit pivalya yutigo kisani.
Thanks for the question, Megan, and obviously I don't have the intimate details on Department of Education's activities. I do know that all departments have been working very closely with Dr. Patterson's office on reopening plans, and education is obviously one of the key stakeholders in the opening schedule and plan. And I do know there's going to be more information coming out later this month on the school opening strategy and plan. And as you mentioned, the officials from education are sitting down with DEA officials today. So hopefully that will outline the communication protocols better so that everyone can continue to work together in moving this path forward.
Kuyan nami ilulingin ni kaya malatang ikalwakto nga kano iliyokutingin ni ilinnar niliriyikut kisaya nita ko pilir hati khatsya khattaktulu ta Patterson mi matukan nila nang maparnaw tilir palya tilugit ta ko pilir khatawlo ang warnak pa ilinnar niliriyikut amalo tukisi giarutit saning sakhir to hakkan nila to ilinnar bit matukan palya larning ita parnaw tingin ni ta ko lekna yaktingi ilinnar niliriyikut man nakati makhati kharner to ilinnar to liriyikut kati mayingin ni naling ni lalo na siya ang naktot sa bukan o sa makatigit sa kanang ng mga tapil makatigit sa kanang lutilo.
But why would plans be made about schools opening without the DEA? They're the people on the ground. Why wouldn't they be involved from the beginning?
Sumalita ko pang nauta kapala tilugin na ilin na tuloy ko kati mayingin nila o katangila.
Unfortunately, Megan, I can't answer that question. It'll probably be best directed to the department.
Mamaya na galota nakiugun nang inakutay ko pili ribing atari nga ako biya ka unaksa.
Next question for Dr. Patterson, please.
You should see a doctor.
Dr. Patterson, I'm wondering about the test swabs from the mine. Can you tell me whether or not they had the right swabs at the mine and when they were sent out?
Luta Patterson ta ko akaw ya sa utiyo katakto jo na bimita ko at sa galo mga ta malawalak titaw sa malang mga ta nalo na yon nakyo.
They have the right swabs and media for the machines that they're using at the mine sites, but they are not compatible with either not compatible or have not been validated with the machines that are being used in the southern labs. So when the samples got to Iqaluit on Friday, we actually could not test them and had to send swabs to the mine to be recollected so that we could test them in the labs in the south.
Takot siya latang mga tawag na bimikaw sa utiyo tako na manas malawngin mata malo nalo na taw sa magum nalawngin mata kalo na ni tunog sunak kutangin no kaw sa kutinot tako talang may tikiti taw law to kalon no ato kun nalawngin at tigo tay may makaw sa kutit sa ni tapaw nga awlak tit siga kalaw to tay ma kalo na ni kaw sa kutiyo no atok taw sa kon naksikolo.
So when were the correct swabs sent south?
I think they got into Iqaluit Friday. I'm not sure if they got to Iqaluit in time for Friday's flight. I think probably not, in which case they would have gone out on Sunday.
Angutin ng mga tanalo nakto kisani kay natsingo jami patsa ulak titaw gayak tumini.
You were talking about having a quicker diagnostic turnaround in territory before you could think about removing the requirement to isolate down south. And you said the Spartan tests weren't a possibility that you thought they were before. Can you give us more information on where you are with having faster diagnostics in territory?
Hauisakutit siani tamani Nunavut miu hausakayuga vitay makila miu naksakkuta kualo Spartan gunikaktauyut atutiu gunda yung mata tukisitit sigat kannirum nakita mani hausakut nautikang mang Nunavut iloan.
Thanks. Just a longer discussion. So the Spartan device is approved for research only. It may become available for proper clinical use at some point when all of the problems have been solved. But until then, we have no idea when that device will become available. I'll let Uli, I'll try to chunk it up. So.
Hoyan nami iyaku tana kuna lokiu naktakalo kata ko apitju tigillugi Spartan hausautiu nakaktauyut. Sulang yaktau si mamata hausautit sautuin naklutik. Malo kiglisin ako tiulutik tama inulisay nak mo sulit hausakat saungin matas tamakwa kaungili ko tiu ningin lalo na yaktau laungin ningin ni lalo naktokang ako ato kung naksijaw kayang mangata.
We have gene expert devices, one here in Iqaluit and now, for a little while now, one in Rankin Inlet as well. But there's still a worldwide shortage in the number of cartridges or test pouches that are available for it. And so we can't use it for our day-to-day use. We get 20 to 30 cartridges a week, and in an outbreak we could we could use up the amount that we get in a month in 3 or 4 days. So we reserve the gene expert for situations where it's a delay of even a few days is too high of a risk. Elders' homes, other congregate housing shelters, situations like that. And I don't know when they're going to solve that shortage. Thought I could squeeze in that last sentence. Sorry.
They made the gene expert mi hausakut hakalo aktu tamani halunni amalo kangasinang mi they made to simalektut nunakjali mamila amigak simata tamakuning hausakutin pus simayolun hausakutin utat sumunga sunakkuta matoktaw galim tikititaw hataktugo 20 nik 30 nilo ila ato hataktugo man na yok 20 nik 30 no pinasa ako si tamat kasi anili siyang maktokalang nakad isumalom na kayang atak ko nungut siya tigi kayang ataw ni pingaso ni si tamanilo ni tako sa nakbaksi mayago gene expert mo sa kutiyo kasi ani at kingubakayak to kang nakad ulo ni tamak ko nung isumalom na kayang atamak ko siya makbiw nakpangagum nakto ni surlo inayang ikangin ni ubalon ni ilumyo katigigasan ni dahil may isumalom na kayang at dahil may mat sa nakbaksi makataktab.
The third device that we've discussed before is the BioFire, which it runs a panel of unlike Gene Expert and Spartan, it doesn't just test for COVID. It runs a panel where it tests for, I think it's 14 different pathogens, bugs or germs that cause respiratory tract infections. I'll let Uli interpret that.
Tana pinga joat sanakutakaw sa kutiyo ate kaktok BioFire. Dahil mahadjiging itangatat sa Gene Expert ang malo Spartan ngunilaktaw yun. Tana hawi sa kutiyo nang ataw sikut 14 nik tamakuning asang magunak tunik ipinali ko taw gunak tunik.
We have one ready to go here in Iqaluit. There's one in Rankin Inlet with renovations happening at the health center there so that it can be properly set up. And the device in Iqaluit, I think it might have started the lab staff may have started the work to get it validated either last week or this week.
Tana ikalod ni ito kaw sa kutiyo Amalo kangersinermo tayo kalarsuni tainan sana jaugialaok tillugu kangersinermittu iniqatsialilaangat taannaqauyisaqutiuyuq iqalunni pigiartaussimalertu taakkununga aungersilimmiiqqanaayartinut pinasaaqusiuloortumi balu tapani pinasaaqusermi tammaqattaqayangi ngaluarmanga qauyisartauvalliani.
It sounds like the manufacturers of the biofire will be able to deliver enough cartridges to meet our needs for even our routine testing. But I don't know exactly when we'll be able to start using them. I don't want to give a date because I wouldn't have guessed we'd be in July and we're still having this conversation. And we've all heard things and then it just doesn't pan out. So we're figuring out if we can set up a system where with the 2 biofires we can do all of our testing in territory.
Taana kampaniyuyuq ilasangassiu taakkuninga biofire uniqartauyunik atuqattaqunarsigayartus javut qauyisaqutiuqattarluni kisiani qangakkuumanga qauyimanangittoq ullunganillu nalunaersimayuqaqani tamaani July miuniarseriyaqaluavu kisiani tamaani suliuqauserituinnarpavu sulit pissimanginattigu taakku maqqu qauyisaqutiuyu atuinnauleqqatiqalunni kangersinermillu tamaani nunavummi qauyisaqutitsiaqalerinnarsigayartugu.
And just one more little tidbit. I get it that everyone's frustrated with how long it's taking, and I appreciate the patience that people have shown. The reason for doing it this way is these devices have been validated. They've been approved by Health Canada and internationally. And we can incorporate them as part of an overall healthcare system where the testing is compatible with the labs we work with in the South, where we know how reliable it is, and it just fits well with our entire response, not only to COVID-19, but to other pathogens. This device lets us test for pertussis. It lets us test for RSV and a number of other pathogens that we deal with on a regular basis in Nunavut.
Ilagakannigalalugu taanna ila akuniulualerninganik teema huyaligaluartungu taqqikunnatsiangata taakkunaluneertaussimatseeriaqangata angertaussimagiaqarsutilluaanneaqarnangittuleriyikkunnu kanatami nunarjuamilu tamanna tuutiu ilaliutiutsiaqajartu aanneaqarnangittuleritsussittinnu tamaani ammalu aulartitsiqattarlu taqallunaanu taama tammarsimangittunik qauyimatsiarlu tigulu tammaqattaqayanginninginnik taanna nuvajuarnaq 19 mutuinnaaq toqaangagayangimmat kisianittaa huirsurnartumu qanimamut ammalu ipiniarnartuma RSV uniqartauyimu tamakkua qauyisaqutiussinnaangu qattarunnarsilaangat.
And so then when we have those machines ready to go for diagnostic capability in territory in Iqaluit and in Rankin Inlet, and the curve, like transmission looks low in the southern locations that we travel to, is that when you would be comfortable to get rid of the isolation requirement?
Taakku atuinnautsaaleqqataqauyisaqutiuyu taimaalli taggaa nunavummi qauyisaqutitsiaqarnereeliqarjaqqi tamaani qalunni kangersinermilu ammalu qallunaani siarmapalliagunniernersaup vallialerneqqa teema akarsaliqajaqqi taakkua qallunaani inutuuttaiiligiaqaq liqajarninginni tuyurmibinni.
Yeah, that's the discussion that we're having in the Department of Health and in my office right now is the possibility of altering the measures at least partly when that becomes available.
Taima taggauqausa qattaqqallialertigu aanneaqarnangittuleriyikkunni taatsuma allabbingani taakku atuinnauleqqataqauyisaqutiuyu assitsertaagunnaqajartu manittaukkareaqartitavu.
Ken Driscoll, ABTN National News. Dr. Patterson, you mentioned getting replacement swabs to the mine. The mine, from what we've had explained, is isolated from the rest of the territory. How do you go about getting those replacement swabs to the mine when it's isolated?
Henrys ko repeat yan kung nikluta Patterson tako aking ubiutit sa iyo yakang nerbi mekaya sa kutit said tanaw yakang nerbi upataw ga haktit na gawas ngin na vuminga to ni kanulit ako tikititaw la katay may galawak tilong.
With a charter flight from the mine to Iqaluit and back.
Hangat atitaw yukut tamangat ikalun ni ngalun ni uyakang nerbi mo tayo mau tikon na to yung nakayak to ta hangat atitaw yun.
And the exchange happened at the airport, so exposure to Nunavut is very small and no different from the other flights that happen on a pretty regular basis, and especially in Nunavut, aircraft are and the airline industry is essential, if not critical. So.
Tako tuni jaw hatta kayang ata hangata yu kuvim me amalo sa magunak ni ngani sa malud na kayang matay ma hangata yu na vumi awla kata hatta nang ata tay mga lima ta ko alo hangata yu lirin ta man na pim makiumat inusitin no.
You don't have to look very far online to see photos of Nunavut teachers on vacation in the South. I'm wondering, due to the request to go through the hub on the way back, do you have any idea of the number of teachers who decided to ignore your advice and went south this summer?
Tako nakatang ano na vumi ilin na tit si kikalik to kalunani tay mali utilik kata tay ma inutuga kala ningin no taman na isumalun na ka.
No, I don't.
Aga.
I'm wondering, do you have any concern that come mid-August, when teachers who left and new hires who will be coming in will have to go through their 2 weeks of isolation, do the isolation hubs have enough capacity for that and the medical travel and the other people?
Isumalo ta kakki sulo agis nungwani ila kitiani tamakkono ta tamalo uterna tulin na tutsi utek pala kata makuni pinasa ko sini tuyok may kay nakakala may mata ini katsala tutsa bata makko kakan ni ngagawan na bila kataktoy.
Thanks. It is a bit of a concern, and it's why we changed the process a little while ago. When the hubs were originally set up, we didn't want to book weeks and months ahead because of all of the uncertainty around it, and as we're moving into summer, knowing that if the hubs are still active, there will be increasing demand in August. We've been asking people to book ahead to try and get an inventory of what it's going to be like in August. And so, there may be a time where we have to get more rooms, but we're still figuring that out.
Kuyan nami taman na ilay sumalom nakto tay may message law sumababo tamak ko malit daw gali to yung may kay nakitaw ga hamot pinasa ako sa kasayro balutak ka kasay subong kagut init saliw katalawng itigo taman na nalunak ni kung ano kasi ani aw yaw lak tilugo tamak ko sulit inuto kataka hakata to yung may binni nalunang mami song lang ata agas ngulik katay may mat init saliw katako ilak ko agas muno ila utik palya yo no takwa ilo ko sa hakan na kala mga ta kawjiga kala kata.
And I almost forgot, as of last week, there is a second hotel available for general travelers in Ottawa, and it's partly because of increased general travelers, but it's also as the hospitals open up and clinics and specialist clinics in the south. There's more Nunavut heading south for urgently needed medical travel that had been delayed because of the closures in Ottawa. So there's multiple reasons for it.
Pinasa ko siya lakto may dan ko sa yugat ila tulian ito yung may minalo na taw sa mayo kalekto tamak kuno nga pityo ti kalawang ito no tamani arwa may nga katakayalin not inutukal na katakayalin not malutaw na nakalo na ni Anna belo imati pallalak tilugit ang maluluta makit ato na naksaw tilugit Nunavut taw nung naksaw katalang atatamak kuning ato avang nakto ni Anna belo ti kakayalit king overreact taw sa malaw nga taman na pityo ti gilugot at sige ngito ni pityo ti kaktugal wa kasi ni inakakan nila to.